The appearance of another new Ebola case in Dallas sent fresh tremors through the healthcare system today. They radiated all the way to Washington and the White House.
We are going to be monitoring carefully the health status of the other healthcare workers in Dallas. And obviously they're concerned. We understand that many of them are scared.
The president had planned to fly to the Northeast for campaign fundraising, but he called off the trip to meet with top health and national security aides on Ebola.
If we do these protocols properly, if we follow the steps, if we get the information out, then the likelihood of widespread Ebola outbreaks in this country are very, very low. But I think what we've all learned over the last several weeks is that folks here in this country and a lot of non-specialized hospitals and clinics don't have that much experience dealing with these issues, and so we're going to have to push out this information as aggressively as possible, and that's the instructions that I've provided to my team.
The meeting came hours after a second nurse at Texas Health Presbyterian Hospital in Dallas was diagnosed. She was identified as 29-year-old Amber Vinson, a co-worker of Nina Pham, who's also infected. Both nurses cared for Thomas Eric Duncan, the Liberian man who was treated at the hospital and died of Ebola last week. It is not yet clear how either woman caught the virus.
We're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now, but we're looking at every possible angle around this.
To make matters worse, the CDC announced that Vinson took a Frontier Airlines flight from Cleveland to Dallas on Monday night when she already had a slight fever. The agency head, Dr. Tom Frieden, says she should have used controlled movement, not a commercial flight.
That can include a charter plane, that can include a car, but it does not include public transport. We will, from this moment forward, ensure that no other individual who is being monitored for exposure undergoes travel in any way other than controlled movement.
Frieden says there's a very low risk to other passengers on that Frontier flight, but officials are asking them to call a hotline for monitoring. The airline says the plane was cleaned afterward, consistent with CDC standards. And the nurses' relatives in Kent, Ohio, are being asked to self-monitor for 21 days. As for Vinson herself, she's being transferred to Emory University Hospital in Atlanta. It's one of 4 facilities nationwide with specialized isolation units to care for Ebola patients. Back in Dallas, emergency crews started decontaminating Vinson's apartment before dawn, much to the concern of neighbors.
I woke up about 7 this morning, just from hearing the helicopters and all that. I saw a text message from my roommate saying that there might be a case of Ebola down the street from where we live. So, I kind of woke up, freaked out, came outside.
All of this as the Ebola death toll in West Africa rose again to almost 4,500 out of nearly 9,000 cases.